President Obama calls those 5 million cancellations of individual health care policies a mistake and a misunderstanding. His critics call it an outright lie and a deception. Tonight, Chief National Correspondent Jim Engel tells us the administration knew millions more policies would be canceled, but said the opposite.
The president may be doing a lot more apologizing because almost 80 million policies from small and large employers are likely to be canceled along with individual policies because they don't meet the requirements of Obamacare.
At least half of people on employer plans would, by 2014, start losing their plans as well.
The administration estimated that approximately 78 million Americans with employer-sponsored insurance would lose their existing coverage due to the Affordable Care Act.
And even more of the 157 million employer policies are set to be canceled next year, according to projections the administration itself made back in July 2010, making clear that officials knew the impact of Obamacare 3 years ago. In fact, its mid-range estimate was that by the end of 2014, 76% of small group plans would be canceled, 55% of large employer plans would be, 63% in all. And some official estimates were even higher, while Jay Carney and others only reluctantly conceded that a few million individual policies would be canceled, about 5% of the market. The officials knew all along that the number was far greater.
On top of that, there's a lot of people with employer-provided plans who will lose their policies as well, and that's tens and tens of millions of people.
Why? Because their current plans don't meet the requirements of Obamacare, which dictate that each plan must cover a list of essential benefits, whether people want them or not.
Things like maternity care, or acupuncture, or extensive prescription drug coverage. And so now the law is going to force them to buy other policies that, they could have gotten in the past if they wanted to, but they chose not to.
Some plans have already been canceled, and employers are getting sticker shock at the new higher prices under Obamacare.
It does not meet the minimum standards as stipulated under the law. Due to this one change, our premiums are now scheduled to increase by 52.3% in January 2014.
The old plans that are being canceled are meaningfully cheaper than the new plans that are Obamacare compliant.
And a new wave of cancellations and sticker shock will emerge just as we approach the 2014 elections.
They're going to start doing that in the summer, early fall, so certainly before the midterm elections.
And it'll be impossible for the administration to escape blame since it predicted those very cancellations 3 years ago. Brett?
Okay, Jim, thank you.